Hi, I'm Jacob West, and I encountered a patient at the Glacier Hills Care and Rehab Center, and I'm going to present to you a full health history. Patient is 69-year-old Caucasian male who's still married and is a retired construction worker. His chief complaint is recovering from a stroke where he lost function on the left side of his body. Upon arrival, I obtained vital signs, a blood pressure reading of 114/68, respiratory rate of 22 breaths per minute, pulse rate of 97 beats per minute, and a temperature of 37 degrees Celsius. Basic HPI. On January 29th, patient underwent open heart surgery involving surgical replacement of the aortic valve due to aortic stenosis. Patient suffered a complication during surgery which resulted in a stroke that has affected the left half of his body. He was admitted to Glacier Hills Care and Rehabilitation Center after being discharged from the hospital. Patient needs full assistance with ADLs, including feeding and urination. Basic health history. Patient was diagnosed with aortic stenosis. He was diagnosed with COPD about 1 year ago. He has had chickenpox and measles as a child. Immunizations. Patient states that he is up to date on immunizations. He has refused the flu vaccination. Allergies. Patient has no known drug allergies. Hospitalizations and surgical history. Patient has a vasectomy. He had a hernia repair. Current medications. Patient is on numerous medications for COPD, diabetes, and endocarditis. Health habits. Patient is bed and wheelchair ridden. Patient suffers from a lack of sleep due to COPD breathing. He suffered a previous fall. He has normal hospital nutrition. No excess caffeine. He requires a lift for urination and wheelchair for mobility. He started chewing tobacco at age 8 and quit 7 years ago. And he has a history of smoking, 1.5 packs a day, but quit 30 years ago. Psychosocial data. He has good contact with his family and friends. He has no known stress to report. Patient states no environmental hazards, no spiritual practices. Patient has an 8th grade education level. Patient has no regular hospital visitation. Family history of chronic disease. Father suffered a myocardial infarction. Paternal uncle suffered a myocardial infarction. Grandson underwent open heart surgery at 5 months old. Patient states does not know the correct procedure. Review systems. Cardiac system. Patient is unable to perform ADLs due to loss of function in left extremities after stroke. His father suffered from a myocardial infarction. Paternal uncle suffered from myocardial infarction. Grandson underwent open heart surgery at 5 months. Patient maintains regular body weight between 175 and 179 pounds. Patient was diagnosed with aortic stenosis, states no other history of cardiovascular problems. He underwent surgical aortic valve replacement on January 29th. It was successful other than suffering a stroke. Patient developed endocarditis, which is treated with multiple medications. Patient states no other infections. He underwent an induced stress test about 1 year ago, and patient states no other diagnostic tests. Patient is borderline diabetes mellitus type 2. Patient states that cholesterol and TAG levels are unknown. Review systems, respiratory. Patient was diagnosed with COPD about 1 year ago. He treats it with 2 breaths of albuterol in the morning. Patient states that it helps relieve his breathing habits. He has more rapid and deeper breathing when moving or sitting up, and it causes aggravation. He cannot perform ADLs because patient cannot walk. Patient states no other family members have had respiratory problems. Patient has difficulty with activities once found easy. Patient states he received pneumovax. Assessment findings for cardiac. Upon inspection, I inspected no heaves or lifts on the chest region. Palpation revealed no thrills or lifts over the 5 key areas. Auscultation of the 5 key areas, aortic, pulmonic, Erb's point, tricuspid, and mitral, showed no abnormal sounds. Patient is unable to perform supine auscultation because of lack of movement, as well as I was unable to listen for S3, S4 because patient lacks stability on left side. Assessment findings: respiratory. Inspection shows symmetry, no injuries besides an incision from the surgical procedure. Patient has no deformities, no discoloration. AP transverse diameter is not 1:1 due to his COPD because he is in the early stages. Upon inspection, breathing shows slight distress and deep inspiration but decreased expiration. No severely abnormal rate of breathing. Palpation of trachea is midline. I was unable to palpate posteriorly on the patient because he lacks stability. Auscultation of the anterior lung sounds showed wheezing in lower and middle lobes bilaterally, as well as on lateral lung sounds, there were decreased lung sounds. I was unable to perform auscultation on the posterior portion of the patient's body. I was unable to perform posterior tests for consolidation such as bronchophony, egophony, or whispered petroloquy. Other pertinent systems: musculoskeletal. According to Richard Kendall, it would be pertinent to perform a musculoskeletal system assessment because of the high prevalence of functional problems in the extremities of stroke victims. Kendall also summarized that common problems are seen in the shoulder of stroke victims. Often there are rotator cuff injuries and subacromial impingements. Patient has lost function in left arm and leg and has had one previous fall during his time at the hospital which injured his shoulder. Other pertinent system I would look for is peripheral vascular. According to Sarah Bott and Mark Dransfield, COPD, and I quote, involves the systemic circulation and can impact non-pulmonary organs, end quote. As a result, I would perform full assessment of the peripheral vascular system related to COPD.